Let me ask you a question. How many doctors have you seen for your pain? 2, 5, 10? And after all these visits, all these prescriptions, all these procedures, you're still here, still searching, still hurting. That's not a failure on your part. That's a failure of the approach. In the next 12 minutes, I'm going to show you what 20 years of experience and over 20,000 patient visits have taught me about what actually works for chronic pain, and it's probably the opposite of everything you've been told. You've tried medications, you've done physical therapy, maybe you've even had surgery or two, and yet you're still here. The pain is still there, and at some point you started wondering if maybe this is just your like now. That thought alone is more damaging than the pain itself. I'm Dr. Sudhir Rao. I'm triple board certified in anesthesiology, pain medicine, and functional medicine. I've treated over 200,000 patient visits, and I see the same patterns destroying people's progress every single week. Today, I'm going to walk you through 5 lessons that 20 years of treating chronic pain have taught me, lessons that most doctors never connect, and that could completely change how you think of your own pain. Most patients come to me believing their pain means something is permanently damaged. That belief alone keeps people stuck. Pain is your body's alarm system. But here's the thing about alarms. Sometimes the alarm keeps ringing even after the fire is out. Chronic pain often means that the nervous system is stuck in a loop and not that the body itself is falling apart. Here's what nobody tells you in a 7-minute doctor's appointment. Your pain might be real and the original cause might already be healed, but the body is still stuck feeling the pain. I see this constantly. Patients come in with an MRI showing a disc bulge, and they think that's the whole story. But research shows that over 30% of people have abnormal MRIs with no symptoms, and others have significant nerve damage with subtle imaging changes. The scan alone isn't always a telltale sign of what's happening. Think of it like a car alarm. Someone bumps into your car in a parking lot. The alarm goes off. But even after the person walks away and there's no more threat, the alarm keeps blaring. You don't need to replace the whole car. You need to reset the alarm. That's what's happening with a lot of chronic pain. The alarm is stuck. Ask yourself, am I treating the alarm or am I trying to figure out why it's still going off? The single question can change the entire direction of your care. But resetting the alarm alone is only possible if you understand why it got stuck in the first place. And that brings me to the second lesson, which is the one that makes me want to throw my phone across the room when I see practitioners get it wrong. Lesson number 2, traditional labs and imaging don't tell the full picture. Most doctors run the same standard panel, look at the same imaging and results and say everything looks normal. Meanwhile, you feel terrible, you're exhausted, inflamed, you're gaining weight and in pain. The problem isn't that you're imagining it. The problem is that the standard blood work only shows you a fraction of what's actually happening inside your body. Here's the lie everyone believes. If your labs are normal, you must be fine. That is one of the most dangerous assumptions we have in modern medicine. In my functional medicine practice, I run advanced panels that look at inflammatory markers, nutrient deficiencies, mineral imbalances, hormone levels, and organic acid profiles. Almost every single time, we find something that was completely missed, not because the previous doctor was incompetent, but because they were using the wrong map. It's like trying to diagnose a car problem by only checking the gas. The gas gauge says full, so everything must be fine, right? Well, meanwhile, the transmission is slipping, the coolant is low, the brakes are grinding. The standard labs are just your gas gauge. They're not wrong, they're just incomplete. If you've been told everything is normal, but you still feel awful, you don't need to accept that. Ask your doctor about advanced inflammatory markers like hsCRP and homocysteine. Ask about a hormone panel. These requests can open up doors that you thought were closed. Where things really get interesting. Even when you find what's wrong, the treatment approach matters just as much as the diagnosis. And this is the lesson that changed everything about how I practice medicine. If you like what you're hearing and this feels different from what others have said before, hit subscribe. This channel is where I break down real answers for chronic pain and longevity. No fluff, no overselling. Just what I've learned from 20 years in the front lines. Now let me show you about lesson number 3. Lesson number 3, you can't fix chronic pain with a single treatment. This is the biggest pattern I see. A patient comes in and said, I tried injections, they didn't work. I tried physical therapy, it didn't work. And when I dig deeper, they tried one thing at a time in isolation, without integration. Chronic pain is rarely caused by one thing. So treating it with one thing almost never works long term. Stop looking for the answer. Start looking for your combination of therapies and treatments to solve and hopefully improve your quality of life. In my practice, we combine precision diagnostics with targeted treatments and ongoing optimization. One patient might need an epidural injection to calm the nerve, combined with hormone optimization to reduce systemic inflammation, combined with a targeted supplement protocol to fulfill nutritional gaps. Remove any one of these and the wheels come off the bus. Ask yourself 3 questions. Number 1, has anyone ever looked at my pain and my labs and my lifestyle together in the same conversation? Number 2, am I being treated by one specialist who only sees one piece of the puzzle? Number 3, have I been given a plan that addresses root cause, or am I just managing symptoms month to month? If you answered yes, yes, and symptoms, you're in the pattern I see all the time. And the fix isn't another single treatment, it's an integrated approach. But integration only works if you know what to stop doing, and most patients are unwillingly sabotaging or unknowingly sabotaging their own recovery with one specific behavior, and that's point 4. Lesson number 4, inflammation is the silent driver most doctors ignore. It's the root of all evil. Here's what I want you to stop doing. Stop ignoring the role of chronic inflammation in your pain. Most pain patients are treated as if pain is a mechanical problem only. Fix the disc, block the nerve, take the pill. But in my experience, systemic inflammation is quietly fueling the fire underneath almost every chronic pain condition we treat. Your pain isn't just in your back or your legs. It's in your blood. It's systemic. I see patients whose pain drops 30 to 40% just from addressing the inflammation through diet, supplements, and hormones before we touch a patient with the procedure. That's not coincidence. That's what happens when you stop pouring gasoline on a fire you're simultaneously trying to put out. Here's what to stop. Stop treating pain relief and overall health as 2 separate projects. They are the same project. If you're eating highly processed foods, not sleeping well, your hormones are declining, and no one's checking, your inflammation is super high, and that inflammation is making every pain signal louder. Here's what to start. Begin viewing your pain through 2 lenses. Lens 1, what's the structural or nerve issue? Lens 2, what's the inflammatory and metabolic environment my body's in? If you're looking through just one lens, you're only getting half the picture. And this leads to the final lesson, the one I wish I could personally tell every patient I've ever treated, because it's the one that actually gives you something you can do tonight. Lesson 5, hope is a clinical tool, and here's the action steps that prove it. After 20 years, the single most important lesson I've learned is this: patients who believe improvement is possible recover faster than patients who have given up. That's not motivational fluff. That's real research showing that mindset directly influences pain perception and inflammatory response. But hope without a plan is wishful thinking. So let me give you a plan. I had a 50-year-old executive come to me. He was overweight, exhausted, stressed, in chronic pain. He'd seen multiple doctors. He was ready to accept this was his lot in life because of aging. Within 6 months, through an integrative approach, he lost 40 pounds, increased his strength by 30%, saw his chronic illness markers drop, and he told me he felt like he was 35 again. What changed? It wasn't one magic bullet. It was a comprehensive root cause approach that addressed his pain, his hormones, his nutrition, and his inflammation together. He stopped treating pieces and started treating the whole picture. Tonight, I want you to do one thing. Grab a piece of paper and write down 3 columns. Column 1, write down every treatment you've ever tried. Medications, procedures, surgeries, you name it. Column 2, next to each one, write whether it was addressing a symptom or a root cause, and be honest. Column 3, write down what has never been tested or explored. Has anyone checked your hormones, your inflammatory markers, your nutritional status, your sleep? The 3rd column is the roadmap. These gaps are where your answers are hiding. Bring this list to your next doctor's appointment and ask, can we look at these? That single action can change the trajectory of your care. This exercise forces you to see the pattern for yourself. Most patients have never mapped their treatment history this way. When you do, you'll see the gaps, not the treatments. Explain why you're stuck. Here's what I want you to take away from all of this. Your pain is real. Your frustration is valid. But the reason nothing has worked yet is not because you're out of options. It's because nobody has connected all the pieces for you yet. There are answers. There is a path forward, and it starts with you seeing the full picture. If this video shifted how you think about your pain, watch this next one. I'm going to break down the number 1 reason back pain keeps coming back, and it's something almost every doctor overlooks. Click right here or check the link on the description, and I'll see you in that video.